Welcome back to Surge Ahead. Last week we introduced Professor Mark Shrine, the new chair of RCSI Global Surgery. Today we will be introducing our new colleague in Malawi, Dr. Linda Chokotho. Dr. Linda Chokotho was the first female orthopedic surgeon in Malawi, and while volunteering at the Queen Elizabeth Central Hospital, she established the first hand surgery clinic to improve management of hand conditions. She's a fellow of the College of Surgeons for East, Central and Southern Africa, COSECSA, and also member of the core group of the WHO, the World Health Organization, Mentor VIP program. Dr. Linda Chokotho, thank you for being here. It's a pleasure having you in the Surge Ahead. How are you?
Thank you. I'm fine. How are you too, Antonio?
I'm fine, thanks. I would like to start the interview asking for your decision of becoming a surgeon. Malawi is a country with just a few surgeons and even a fewer number of female surgeons. When did you decide to become a surgeon, and how was the process until you achieved it?
Let me start by explaining why I decided to do surgery. I graduated at a time when in our country HIV was at its peak, but at the same time we had no drugs to manage patients with HIV, both antiretrovirals as well as antibiotics, which we could use to manage opportunistic infections then. So really working on the medical wards was really quite depressing, because as a doctor, you are expected to help patients, but all we could tell patients then was, sorry, you've got HIV, there's nothing we can do for you. Pretty much for most of the patients, that's what we used to do, and that really became so depressing. So then I felt this is not really working well for me. I need to help people. And when I looked at the surgical specialty, especially in orthopedics, because I am an orthopedic surgeon, I could actually see that if you fix somebody's bone, somebody's fracture, you could see the results and the patient would appreciate. So that's how I ended up moving to surgery to become a surgeon, to train as a surgeon. It wasn't an easy decision, because there were no role models, really, female role models that I could look up to. But then because of the satisfaction that comes with helping people, turning disability into ability, when you fix fractures, when you treat patients with orthopedic conditions and other surgical conditions, I still felt that was the right way to go and that was the right career path to take. And so I pursued that career path because of the satisfaction that comes with helping patients. I had problems with sometimes people would think that this is a job for only males. That was there all the time, some negative comments, but because I had that satisfaction that comes, as I've already said, that kept me going, even to overlook all the negative comments that I got along the way.
Thank you for your answer. Dr. Chokotho, you are the research coordinator in the Department of Surgery at the College of Medicine, University of Malawi, and you are one of the SURG-Africa researchers in the country. How did you get into research, first of all, and how do you think your experience as a surgeon is helping your new role?
During my training, as I trained as a surgeon, I noticed there are two things that made me start to think about research and global surgery and the public health aspect of surgery. Firstly, I noticed that most of the conditions that we treat, especially in orthopedic surgery, were traumatic. And with good prevention programs, they could be prevented. As a result, we could have reduced burden of the cases that we see. But as clinicians, we don't really look at the prevention aspect. We are just interested in treating what comes to us. So I felt that there needs to be some balance. Yes, we are surgeons, but we also need to look at the prevention aspect of it. Is there something that we can do to reduce the burden rather than just accepting that this is the status quo, this is what we have, and therefore we have to treat all patients as they come without even thinking about the prevention aspect. So that's the first part. The second part is that I felt that we don't have enough information to know the outcomes when we have provided treatment. So we do a lot of things that are very different because of the limited resource setting that we work in. The way we manage our patients is quite different from the way similar patients are managed in the Western world, for instance. But then we don't know whether what we are doing is right. We see patients in clinic, they come, but we don't have evidence to say, okay, we are managing these patients because we have limited resources, but these are our outcomes. So I felt that there was a gap there as well. So, and because of that, then we cannot, because we don't have evidence, number one, we don't know what are the clinical outcomes, but at the same time, it's hard to improve the care of the patients if we don't know what are the outcomes. If the outcomes are good, then that's fine. At least we know they are good. But if they are not good, we need to do something about it. So that's where I felt that research would be important to balance the situation so that we don't just have the clinical aspect, but we should also have the research and public health aspect, so to say. Now, coming to SURG-Africa, they are doing quite a lot of work as well within this, the surgical field to try and improve access to care, access to surgical care, because most our health system is quite centralized in a way that most of the surgical services are offered in the central hospitals. But the majority of our population, 84% of Malawian population, is rural. So now I think SURG-Africa is coming in to help to improve the access of care so that the rural majority should access care easier rather than traveling long distances to get care in the central facilities where the care is also not always available, but they are trying to make the care accessible as well as available to the people in the rural areas. So that's really something that's important. And that is, I mean, looking in the long term, that should be the way to go for all surgical services, really. We need to improve access by making sure that the people in the rural areas are able to access care as close to home as possible. It's something that cannot be done just overnight. It needs a lot of planning, but I think that's a way to go as we go on in the long term to decentralize the surgical services in Malawi.
Thank you very much for the explanation. Dr. Chokotho, one of your expertise and interests in research is trauma. How do you think this pandemic is affecting the trauma cases in the country?
So I referred to the trauma registries that are currently running in several facilities in the country, in 10 facilities in the country. And looking at that data, really, we haven't seen much change in terms of the numbers. There have been some isolated hospitals, like one hospital last week had a COVID-19 death, and then people were afraid to go to the hospital, so there has been a reduction in the number of cases. But in general, we have not yet seen a significant reduction in the number of trauma cases since the COVID pandemic started in Malawi.
Thank you very much. It has been a pleasure having you here. Thanks for your time, and I wish you all the best, Dr. Chokotho.
Thank you so much. I really look forward to work with SURG-Africa to make a difference in global surgery. Thank you.
Thanks again. And thank you very much to everyone for having watched this video. You can access to previous interviews visiting our YouTube channel, and you can access to our updates just following us in our social media. Take care and keep yourselves safe.